Hi and welcome. Today we're going to talk about signs that your body needs a detox and 12 ways that you can support healthy detoxification. Hi, my name is Dr. Arianne Missimer. I'm a functional medicine practitioner, doctor of physical therapy, registered dietitian, and the owner of the Movement Paradigm Integrative Health Center, and I'm a medical educator for Rupa Health. I'm super excited to dive into this topic with you today. So whether you are experiencing different unexplained symptoms such as fatigue or brain fog or digestive issues, you're looking for a more proactive approach to your health, or you are a functional medicine practitioner and you're looking to gain deeper insights into how you can support your patients with detoxification, you are in the right spot. So today we're going to talk about what is detoxification, some red flags that you or your patients may be experiencing that contribute to poor detoxification. We're going to talk about a functional medicine approach and which testing would you consider. Then we're going to also discuss 10 different practical detoxification strategies. So what is detoxification put simply? Essentially, it's the process of making toxins less harmful and eliminating them from the body. We do this through a process called biotransformation, and this involves the liver, the kidneys, the lymphatic system, the lungs, the gut, and the skin. So we want to dive into some of the definitions because I think this is really important as we enter the world of detoxification, because there's so much information on social media about the latest and greatest detox diet, and quite frankly, so much of that is misinformation. So it's really important to understand this at a deeper level. So when we're referring to a total toxic load, think of this as our total toxic exposure minus the ability to biotransform and excrete toxins. So over the course of the lifetime, we are building this total toxic load. So let's just say, for example, we are exposed to mold in our childhood home, and then we go to college, and then we're exposed to mold again. And then in our 20s, we start to get into wearing perfume and different lotions. So we start to use all these endocrine disruptors. Maybe we're using plastics for all of our Tupperware. So we start to develop, we have this increased total toxic exposure. But then let's just say genetically, we're not able to detoxify as well. Maybe we are because we're getting so much exposure, we don't have the ability to biotransform that we once did. So essentially, the total toxic load is the total body burdens of exogenous chemicals, heavy metals, and toxic endogenous compounds. The body burden is the quantity of exogenous substance. So let's say that's heavy metals or xenobiotics, or it's metabolites that accumulate in an individual. So we can begin to have a greater body burden over time, which is ultimately when someone presents with physical signs and symptoms. If we're thinking of a toxin, think of this as a poison produced by a living organism. And then when we're referring to the exposome, this is going to be the measure of combined exposures from all the sources that reach the internal environment from the conception throughout life. So it's complements of the genome. So let's quickly go through some environmental toxins that are most common. So we have PFOA, which is commonly found in our nonstick cookware such as Teflon, water-resistant fabrics, food packaging, and this can be linked to cancer, immune system suppression, and thyroid disruption. Phthalates are something that's found in plastic. So it is really important to begin to shift away from plastics. Personal care products like shampoos, lotions, perfumes, many contain these. Vinyl fluorine, detergents, different toys, and it can be a major endocrine disruptor. It can contribute to reproductive toxicity. So anyone that's focusing on fertility can potentially have issues. It can also cause developmental issues. Persistent organic pollutants, otherwise known as POPs. These are commonly found in different industrial chemicals, pesticides, flame retardants, and it's a byproduct of industrial processes in general. And this can be long lasting in the environment and can be linked to cancer, hormone disruption, and reproductive harm. Then we have non-phenol and non-phenol oxalates, which are going to be found in laundry detergents, cleaning products, textiles, personal care products. The health concerns with this are endocrine disruptors. They're harmful to aquatic life and is linked to reproductive toxicity. Astrazine. So this is an herbicide that is used on crops. So we want to be thinking of something like Roundup, especially corn. Health concerns can be endocrine disruption, birth defects, reproductive issues, possible carcinogenic, and glyphosate. So many of us are familiar with that. So that is in Roundup. So herbicides for agricultural and home, GMOs, and this has been linked to lymphoma, and it is linked to liver and kidney damage and possibly reproductive harm. And then we also have our PCBs. So this is commonly found in electrical equipment, contaminated fish, dairy products. This also can be carcinogenic, linked to reproductive harm, immune damage. We have dioxins that can be found in our animal products, meat, dairy, and processed foods, and also can be endocrine disruptors, cancer, reproductive, immune system. Asbestos, which is something that many years ago many people were exposed to, and that's in insulation, roofing, older buildings, and that can be linked to lung disease and even mesothelioma, cancer. And formaldehyde, so this is in furniture, particle board. Health concerns can be carcinogenic, respiratory issues, skin irritation. And then the last few, we have arsenic. This can be found in everything from our protein powders to contaminated water, rice, and so on. This can be linked to different skin issues, cardiovascular disease. It can also be carcinogenic. Toluene, which is in paint thinners, nail polish, which is something that can be very toxic to us, nervous system damage, developmental toxicity. And then we have flame retardants, which are going to be commonly found in furniture, mattresses, electronics. And lastly is cadmium. So this can be found in batteries and plastics, some industrial processes as well. And this could be linked to kidney damage, bone demineralization, and cancer. This is a short list, but I wanted to give a short list of common environmental factors and toxins that you can see. But just know that this is a very condensed list, but you can start to begin to link what we are exposed to on a moment-to-moment, day-to-day basis, that we ultimately have to not only optimize our natural process of detoxification, but we also have to consider limiting our toxic exposure. So let's dive into the body's natural detox pathways. As I mentioned earlier, we're thinking of very specific key detox organs, including the liver, the kidneys, the GI tract, the lymphatic system, the lungs, and the skin. So ultimately, these systems are going to help convert toxins and eliminate them through urine, sweat, or stool. So when we're talking about phase 1 detoxification, as a high-level overview, think of these are going to be fat-soluble toxins. We are ultimately trying to biotransform them. So we are making them into toxic metabolites. And then in phase 2, we're breaking them down into more water-soluble toxins. And then ultimately in phase 3 is where we're going to eliminate them via urine, bile, and stool. So let's dive in a little bit more specifically. So we know that the liver is an integral component of our body's detoxification system. So we talked about the different phases. So the first phase is going to be involved cytochrome P450, and the process is taking toxins, so let's say alcohol, pollutants, drugs, even medications. They're converted to a more reactive and often more toxic intermediate or metabolite. This is done through oxidation, reduction, and hydrolysis. It requires very specific nutrients like our B vitamins, antioxidants such as glutathione, vitamin C and E, and different flavonoids for proper function. So there's a risk when we have excess free radicals that are produced during this phase, which can cause oxidative stress if not balanced by phase 2. So this is where we can get very targeted in our approach of how we are trying to influence phase 1 also while influencing phase 2, because remember, we want to move phase 2 to 3 for elimination. So phase 2 is going to be focused on conjugation. This again is happening in the liver. The activated toxins from phase 1 are going to be conjugated, or we call that joined, with molecules like sulfur, methyl, amino acids, and it's going to render them more water soluble and less harmful. So the key pathways here are going to be glucogranulation, sulfonation, methylation, glutathione conjugation, amino acid conjugation, and acetylation. The nutrients required here are going to be sulfur-containing amino acids such as methionine, folate, and magnesium. And the purpose, again, is going to make these toxins ready for elimination through urine or bile. And then lastly, we have phase 3, which is elimination. So this is going to happen in the liver, the kidneys, and the intestines. So once these toxins are neutralized in phase 2, the toxins are going to be transported out of the body through bile, which ultimately will be through stool, urine, and sweat. The transporters are going to be ATP binding cassettes, so it's called ABC transporters, which assist the excretion of these substances. And the support we need for this, no surprise, is fiber, adequate hydration, bile flow support, so sometimes that could be bitters or taurine, probiotics to maintain a healthy gut flora and microbiome. And the purpose is to completely remove toxins from the body to prevent reabsorption. So from a GI perspective and its role in detoxification, healthy bowel movements, so that means 1 to 3 times a day that looks like a snake or log, and nutrient absorption are needed for efficient management of these substances. So the small intestine is where most of our nutrients are absorbed, and a healthy colon is going to help us manage substances that have been processed through the liver via bowel movements. So it is really critical that we're optimizing fiber intake, we're optimizing things like prebiotics and probiotics and short chain fatty acids to really make sure that we are supporting this healthy elimination. So the kidneys also play a huge role in detoxification. They help to manage substances that have been processed by the liver through urination. So this is why it's so important to make sure that we have adequate hydration status. We're drinking at least half of our body weight in ounces a day, assuming we're getting enough electrolytes to deliver that water to our cells. And we also want to consider the skin. So the skin is going to help us manage substances through sweating, while our lungs are going to help us manage through respiration. So we don't always think of this, but our lungs are going to play a huge role in detoxifying our body. So the lungs are going to breathe in and out 15 to 25 times per minute, constantly supporting our overall health and well-being. We often think of just getting oxygen into our body, but we often are thinking that we're getting CO2 out. CO2 is extremely important to deliver oxygen to our tissues. So it's just as important to make sure that we are breathing nasally, for example, and we are filtering the toxins that are coming into the body. That's what the nasal cavity does, versus mouth breathing, which does not do that. So our breath and our lungs are going to be vital in detoxification, and they have their own filtration system working alongside with the liver and the kidneys. And then we have our lymphatic system, which is one of the most powerful and neglected systems in the body, and helps to really act as a true filtration system to support the management of substances from our body, protect against foreign invaders, carrying waste from our tissues to the bloodstream. So essentially, we are what we breathe, what we eat, drink, touch, and cannot eliminate. So let's talk about some detox red flags and their implications. So if you're experiencing nausea, vomiting, diarrhea, these could be symptoms that your body is trying to expel toxins. So if you think of when you have been exposed to food poisoning and you're violently getting ill, that's a really good example of that. This can be also associated with heavy metal toxicity or exposure to certain chemicals. But we can also have things like bloating or indigestion or chronic GI issues, and chronic exposure to these toxins like pesticides, preservatives can ultimately disrupt the digestive system, leading to discomfort. We can also have skin issues. So that could be things like rashes, hives, itching. These are a sign that our body's reacting to some type of toxin. That could be something like heavy metals, medication, chemical exposure. Acne or eczema, so persistent skin issues, can also indicate a potential overload of toxins, and maybe that the kidney and liver is struggling to process. Now remember that all of these things can be associated with other symptoms, and that's why as functional medicine practitioners, we have to do our due diligence to really understand clinically what's happening, how is the patient presenting, and do the appropriate testing to truly identify root causes. So we can also have people that are experiencing, or you might be experiencing, chronic fatigue. So chronic fatigue is something very complex that we want to be thinking mitochondrial dysfunction and looking at how someone is detoxifying and looking at their toxic exposure, I think is really critical. So especially if there's adequate sleep, it still could be a sign that there might be some type of long-term exposure. Brain fog is yet another one where there might be difficulty concentrating or memory issues. See this very frequently with mold exposure, mycotoxin illness. There's quite a bit of brain inflammation. So there could be memory or brain fog or lack of focus. All of these things are very, very common. Mood disorders from anxiety or depression, irritability, cognitive impairment, as I mentioned, so decreased concentration or memory loss, respiratory issues. So again, very, very common with chronic exposure. So this could be shortness of breath. This could be a cough. This could be wheezing even from chronic pollutants. So I see this quite frequently with a lot of my patients where we're looking at what their possible exposures are at home and hopefully make some changes for that. Headaches and migraines. So this is, I think, a really important one where it can be anything from exposure to chronic medications or even food additives or pollutants, weight gain or difficulty to lose weight. So any type of metabolic issue where we want to be thinking, is there any persistent toxic exposure that could disrupt metabolism and hormone regulation? Very common. Also insulin resistance and sleep disturbances. So many people are experiencing insomnia. So it's really important to look at all aspects of what might be impeding their sleep, because sleep is going to affect everything. You can't fix anything without proper sleep. And especially if there's exposure to toxins or that might be affecting their hormone regulation, any kind of night sweating, for example, thyroid dysregulation and estrogen dominance. So we see this so frequently with all of the exposure to endocrine disruptors, especially young females who are exposed to whether it's perfumes or shampoos, conditioners. A lot of the different products that they're using are really huge endocrine disruptors and can cause quite a whole host of issues. So we can see that there could be a range of symptoms. And this is why, again, it's so important to understand that these symptoms also could be related to other things. So we want to look at it from a very integrative and holistic perspective. And so that's where our lab testing comes into play. So as we begin to explore proper detoxification, there are several tests that you can utilize as a practitioner. And there's also tests that you as a patient can request so that you can get a better understanding of, is this an issue? Because what we don't want to do is just assume that you have heavy metals and you have mold and you have all these things, but you really don't have any data to show that, and you start treating. Because what I see time after time again is that when patients are coming in and they are self-treating, or just the opposite, they've been to a lot of practitioners and they've been doing protocol after protocol after protocol, that is normally not very successful. So it is very important to understand your timeline, your clinical symptoms and presentation, and match that with the appropriate testing. So here are some of the tests that you can consider. So of course, a comprehensive metabolic panel, so a CMP, this is going to measure your different liver enzymes, which would be really important. Bilirubin, you can assess for liver function. And remember, this is our primary organ involved in detoxification. So you can also use something called gamma glutamyl transferase, which is GGT. So this is a great enzyme, which is a sensitive marker of liver health and oxidative stress. So elevated GGT can indicate that there's impaired detoxification capacity. It's a great liver screen. Then we can also consider something like organic acid testing, so an OAT test. So this can look at metabolic function, mitochondrial health, detox pathways, and looking at specific organic acids in the urine, so which can also be really helpful to look into different nutrient deficiencies that might impair detoxification, such as our B vitamins, our antioxidants, glutathione levels. So when we're trying to get really targeted in our approach, we can be very specific about what we find in our testing. Methylation panel now can be really helpful to look at everything from homocysteine to MTHFR gene, SAMe. These are all going to be critical in your phase 2 detoxification, like methylation and sulfation. Then you can look at things like glutathione and antioxidant capacity. So you could look at your specific levels of this. You can also look at heavy metal testing. So this can be done looking at mercury, lead, arsenic, cadmium in the blood, in the urine, or even hair testing. So that could be really, really helpful as well. You can do gut microbiome testing. So I do this all of the time in my clinic because we can look to see what does the overall gut microbiome look like. Are there any particular pathogens that someone might be exposed to? Is there leaky gut that's affecting nutrient absorption? If the beta glucuronidase is high, that might influence detoxification and, let's say, even estrogen metabolism, for example. So there's lots that we can get out of a gut microbiome test, and ultimately how someone is eliminating. So in that phase 3, we can look at toxin panels. So we can look at mycotoxin testing specifically if we're looking at overall mold exposure. We can look at something like the Dutch test for hormone detoxification. So this could be really helpful depending on what someone is experiencing. And one of my favorite tests is the 3x4 genetic test. So this can be extremely important in looking at specific single nucleotide polymorphisms, so SNPs, that are going to influence detoxification pathways. So this can be really valuable when you've already done some testing and you want to look more upstream to see how is this person detoxifying? What are their patterns? And so that way for one of your patients or for yourself, you might need to work a little bit harder. I'm one of those people, so I totally understand that. You might need to work a little bit harder, do some extra things, and we'll talk about some of the practices in just a moment, but spend more effort on how you're detoxifying naturally. So why are some people more sensitive to toxins? Well, I finished with the genetic aspect of it. And so that is absolutely a factor. But the other things that we want to consider are things like increased ongoing exposure. So remember this cup that's being filled, this total toxic load over your lifetime. And so if the cup keeps getting filled and getting filled and getting filled, eventually something's going to give. So you can become more sensitive to things. So for example, chemical sensitivity. So when I look on my intake forms, when people say that they're sensitive to cigarette smoke and perfumes and all of these different smells, then I know that they're having this multiple chemical sensitivity. And this is a perfect example of what I'm referring to. Nutrient deficiencies are going to be a huge one. High refined processed food intake, inadequate protein, increased chronic stress and emotional trauma, dysbiosis, as I mentioned, the genetic variants. So there's a lot of reasons why some people might be more sensitive. So what we're going to do now is go into 10 different ways that we can approach a healthy detoxification. We're going to talk about basic, simple practices that you can implement yourself or you can have your patients do. If you are performing a very specific protocol, so if you're doing a detox for mold, or if you're doing it for another chronic exposure of heavy metals, there may be very specific applications that I will leave for you to work individually with your functional medicine practitioner, because that has to be so individualized. What we're going to talk about today are some simple lifestyle practices that are extremely valuable. And how I approach it with my patients is that I actually have them work on these things first. So they might not do every one, but I try to get them to do most of them and well before we begin to implement very specific treatments. And I find this to be extremely helpful because we're looking at this from a lifetime perspective, not just take the supplement for 3 months and then call it a day. We want to make sure that you're really promoting healthy detoxification for life. So number 1 is optimize your sleep. So when we sleep, this is actually where we have our cerebral spinal fluid cleansing. We are cleaning out all of the bad stuff, and this is where our brain is truly detoxifying. We need to not think about just how many hours we're sleeping, but the quality of sleep that we're getting. We have so much additional blue light exposure. We don't have time to typically downregulate before sleep. we are waking up and grabbing our phone and having that quick dopamine hit, not a lot of sunlight. So we're never really optimizing our natural circadian rhythm. And 70% of people mouth breathe. So if you are mouth breathing, that is ultimately most likely going to lead to snoring, which is most likely going to lead to sleep apnea. And so this means that you are not getting proper oxygenation. So you're not detoxifying from a lung and breath perspective or sleep perspective. So optimize your sleep. Number 2 is nutrition, which is so powerful. So first, we want to think about focusing on whole foods, anti-inflammatory, nutrient-dense, nutrient-rich, focusing on eating every 3 to 4 hours. That allows time for the migrating motor complex to work optimally to help with motility in the gut. Water and electrolytes, right? Because that's going to help us to optimize our kidney function as it relates to detoxification. 25 to 35 grams a day of fiber, because this is going to help with healthy bowels and defecation. We also want to think of things like green tea. It's rich in catechins. It can improve liver enzyme levels and reduce oxidative stress. But then we can get really specific with phase 1 and phase 2 nutrition. So as I mentioned earlier with phase 1, we're trying to break down those toxins through oxidation, reduction, and hydrolysis. So we can use very specific key nutrients, whether that's in the form of food and or supplementation. So when we're thinking of specific cofactors, we have B2, which is riboflavin, so that's going to support in the cytochrome enzymes. B3, which is niacin, that's going to be involved in the oxidation reduction reactions. And B6 is crucial for amino acid metabolism and neurotransmitter synthesis. So we can also focus on antioxidants such as vitamin C and vitamin E. And we can also focus on flavonoids, such as that are found in fruits and vegetables. They're going to help enhance phase 1 enzymes and really protect us against oxidative stress. So then with phase 2, so remember for phase 2, we're going to think of the conjugation phase. So it's going to be molecules like glutathione, sulfate, amino acids, making them more water soluble and easier to eliminate. So these key nutrients would be the master antioxidant, glutathione. So that is going to be foods rich in sulfur-containing amino acids such as garlic, onions. They're going to help produce glutathione. We can also think of sulfur-containing compounds such as methionine and cysteine. So these are specific amino acids that are really important in this pathway, and they're also precursors to glutathione. And then we have methylation nutrients, so folate, B12, SAMe. We have amino acids such as glycine, taurine, glutamine, arginine. So you can start to see why our protein is super important. And ultimately just thinking of a Mediterranean-rich diet, emphasizing vegetables, legumes, citrus foods, complex carbohydrates, moderate amounts of fish and oil. This has been shown to help with liver disease. So we know that this is really powerful in overall detoxification support. And again, just focusing on those foods that are rich in antioxidants. Omega-3s are going to be extremely important to help improve liver function and reduce inflammation as well. So exercise can be extremely helpful. So one, it can help to improve circulation. It can help with lymphatic activation. It can also help with sweating and skin detoxification. It can also help with reducing inflammation, reducing oxidative stress, and improving gut motility. Next is heart rate variability and detoxification. So we have to be in a state of social engagement, of rest and digest, to really optimize our overall health and well-being. If we are constantly in a fight or flight, or we're in a freeze state, unfortunately, that is when we begin to have more and more dysregulation, especially as it relates to the gut. So we want to be thinking about optimizing the cohesion or coherence between our heart and our brain. It's going to help to promote cellular detoxification because we're going to improve vagal nerve function. This is innervating everything from our ears to our throat to our lungs to our entire GI tract. which we want to be thinking this is our parasympathetic state. This is where all the magic happens as it relates to how some of our key organs should be supporting detoxification. It's also going to help with reducing inflammation, because when we are in that parasympathetic state, that is going to help to exert an anti-inflammatory effect. And it's going to also influence lymphatic drainage by promoting deep rhythmical breathing, because when we're in that parasympathetic state, we're able to breathe in a coherent manner. The next is forest bathing. So this is a practice that originated in Japan, which just basically involved taking a walk in the forest using all of your senses, simply being in nature, slowly walking, connecting, using your senses such as your sight, your taste, your smell, your hearing, and your touch. Exposure to nature, to green spaces, and the practice of forest bathing can support multiple health benefits, from decreasing cortisol levels, increasing diversity of the gut microbiome, activation of the parasympathetic nervous system, reducing anxiety, depression, anger, fatigue, increasing relaxation and awareness, reduction of chronic pain, increased heart rate variability, which we just spoke about, blood sugar control, improvement in blood pressure, and decreased mortality. So it can be really simple, but such a powerful practice to help support our natural detoxification. The next, perhaps one of the most important, is our thoughts and our emotions, and how this is going to have a direct influence specifically on the autonomic nervous system, which is going to ultimately influence our detox pathways, our hormone regulation, our immune function. So this can happen through the effects of stress and cortisol on liver detoxification, because it's going to impair liver function. Also, our gut-brain connection. And remember that when we are in a stress state, when we are trying so hard to get better, we're in a fight or flight state. And ultimately, our thoughts and our emotions are going to influence us on a cellular level. And it's also going to influence directly the gut-brain axis. So we have blood flow that's moving away from the digestive tract. That's going to affect motility. That's going to affect our overall digestion, and can have a significant influence on how we're able to detoxify. We also want to consider the concept of psychoneuroimmunology. So how thoughts are going to influence our immune system. So this can play a critical role in our overall health. And then mindfulness practices. So this focuses on being aware, being present, and this can influence stress reduction, decrease cortisol, and has been shown to improve detoxification by improving autonomic balance specifically, and decreasing the body's overall toxic load. Breathing. This is such a basic thing that we do 25,000 times a day, and we can begin to shift our breathing to slow, deep, rhythmical breaths that will really help to not only increase oxygen, but also to help to maintain CO2 in a bloodstream, allow CO2 to deliver oxygen to our tissues more efficiently, and it is going to improve lymphatic flow, and it is also going to help reduce stress when the vagus nerve passes right through the diaphragm. So that's something that when we are deep breathing, we are going to stimulate the vagus nerve. We're going to release acetylcholine to create a relaxation response. It's going to enhance the elimination of CO2, and it could be a really simple way where we can integrate this before you go to bed, when you wake up in the morning, when you're in your car, and so many opportunities for intentional, slow, deep breathing. I recommend doing a paced breath. So the same amount of time that you breathe in is the same amount of time you breathe out. So let's say 4 seconds in, 4 seconds out. 5 seconds in, 5 seconds out. There's lots of breath practices, but just for some basic slow down regulating breaths, that's a really, really great one. And the research shows that 5.5 seconds in and out is really that sweet spot. But if you have airway dysfunction, then you want to make sure you're breathing at a pace that feels safe to you. The next is castor oil. So castor oil has been used for centuries for medicinal and non-medicinal applications. It can be used for things like inflammation, And it can also be used as an antimicrobial as well. It can help support liver function. It actually can reduce liver enzymes. It also can have an influence on constipation. So there's a lot of great applications for this. So you can use it directly on your liver. You can use it with the castor oil pack over top. And it can be very soothing for patients. It's a very gentle practice and does have some research behind it. Obviously, the research is not extensive. There's way more anecdotal evidence, but there are some studies to support its benefits on detoxification, liver support, and constipation. So there are numerous botanicals that you can use, as well as even nutraceuticals. So one common one that I just wanted to touch on is milk thistle. So this is something that can be hepatoprotective through a number of mechanisms, including its antioxidant activity, its toxin blockade at the membrane level, enhanced protein synthesis, antifibrotic activity, and possible anti-inflammatory or immunomodulating effects. So this could be something that is a very gentle, supportive detoxification supplement that can be used in adjunct to some other practices. One of my favorites is dandelion root tea. So this is often praised for its detoxifying properties, particularly supporting liver and kidney function. So it is a diuretic, so it is something that's going to contribute to increased urination, but it can be really, really helpful and supportive for a natural practice. It also has antioxidant effects, so it contains some polyphenols, which can help to decrease oxidative stress by neutralizing free radicals. So this can be a really great adjunct. So typically I have my patients start with 1 and potentially go up to 2 cups a day, just depending on how they tolerate it. You do want to be mindful if someone has a ragweed allergy. Saunas. So this can also be a great way to support the sweating specifically through the skin. So infrared saunas definitely are known for their detoxification benefits. So that can include enhanced circulation, sweating, and of course even relaxation as well. It also can improve with lymphatic flow. So this can be a really, really great therapy, as well as red light therapy. So low level laser therapy can use very specific wavelengths of red or near infrared light to stimulate cellular processes. So this can help to promote healing, reduce inflammation. So this can be also a great practice if someone has this accessible. And last but definitely not least is lymphatic drainage. This is something that can be extremely powerful. And as I mentioned, it's one of the most neglected systems in the body. We want to think of the lymph system as working with the lymph vessels, the lymph nodes, the lymph tissue. It works in conjunction with the circulatory system, and it handles so much lymph. So 125 milliliters per hour. So half of this is coming from the liver and the small intestine. So you can start to appreciate this really important relationship. And most of our lymph is draining in this left subclavian vein. So the whole left side of our head, arm, body. And we have so much lymph in the abdomen. So in the sternochyli. So this is where we tend to get a lot of congestion. So I always say, if you are working on detoxification, if you have gut issues or digestive issues, your patient does, it's really necessary to implement some type of lymph drainage. We want to remember that movement and breath are going to be really important for what are going to move the lymph. Then we can also do very specific techniques such as diaphragm releases. That can be with a ball, that could be manual, and doing lymph drainage. So we can influence the lymph drainage through different mechanoreceptors in the body. So everything from our Ruffini endings, so slow, deeper pressure, to vibration, to light skin stretch. And if you look at all of these circles, this is where we would utilize our lymph drainage, our key tribal areas. So if we were doing the lymph drainage, we might start with feather light, faster, deeper, 1, 2, 3, 4, 5, and then pull in the direction of the heart. So it's very light, the lymphatic system's right under the skin, but this can be such a vital way to support your lymphatic system. So in summary, hopefully you can appreciate that in our day-to-day lives, we are exposed to so many different toxins, from the facial products that we use to the exposure in the environment to the plastics that we potentially drink from. So we not only want to think about decreasing our exposure and making more mindful decisions. You can use something as a reference called EWG.org, so Environmental Working Group. You can go onto the site and you could research some of your current products that you're using, your cleaning chemicals, for example, and you could begin to slowly decrease your toxic load. But while you're doing that, please also remember to support your natural detoxification processes. Your body has an innate capacity to heal and it knows what to do, but sometimes we have to work a little bit to support those natural things. And as you could see from all of the things I mentioned, they are very easy, simple practices that we really should be doing anyway. But so often these get neglected or they get overlooked in our busy lives. And when we can really begin to focus our time and energy on these foundational things, then we can make a huge difference. So before jumping into a protocol or something that you're seeing online, please make sure that you understand the complex process of detoxification and you're working with a practitioner to help guide you properly in the steps of how you should do this, and really make sure that you're getting the appropriate testing done and you understand exactly what's happening and how to go about it. And if you're a practitioner, I hope that this was helpful and maybe giving you some other tools or different ways for you to look at it and how you can help support your patients. As always, thank you so much for joining. And if you want more videos like this on root cause medicine, please subscribe to our channel.
Welcome to Root Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.